When we reach our 70s, many of us believe that more medical tests automatically mean better health. It feels like the responsible thing to do. We want to stay ahead of problems, catch things early, and do everything we can to live a long, healthy life. But what if I told you that for many seniors, some of those routine medical tests might actually be causing more harm than good? They can lead to stress, side effects, and unnecessary treatments without actually improving how long or how well you live. This doesn't mean you should avoid your doctor or ignore your health. Far from it. It means understanding that as we age, the balance between the benefits and risks of certain tests changes. A test that was crucial at 50 might not offer the same value at 75. Today, we are going to talk about 5 common medical tests that experts say should be carefully reconsidered after age 70, not just automatically continued. Knowing this can empower you to have better, more personalized conversations with your doctor and focus on what truly supports your quality of life. Let's start with number 1, prostate cancer screening using the PSA blood test. For many years, this test was promoted as a lifesaver, and in younger men, it can sometimes be helpful. But after 70, the story changes. Many prostate cancers found in older men grow very, very slowly. So slowly, in fact, that they might never cause any symptoms or problems during a person's lifetime. When a PSA test comes back slightly elevated, it often kicks off a cascade of more invasive tests, like biopsies, and can lead to treatments like surgery or radiation. These treatments come with significant long-term side effects, including urinary incontinence and sexual dysfunction. For many men over 70, experts now suggest that routine PSA screening should be an individual decision made with your doctor, not an automatic yearly test. The key question becomes, is this cancer likely to affect my lifespan or my daily comfort? Often, the answer is no, and avoiding the test avoids a lot of unnecessary worry and treatment. The second test to reconsider is the routine colonoscopy. Colon cancer screening is incredibly important earlier in life, but colonoscopies are not without risks, especially for older adults. The preparation process can cause severe dehydration and weakness. The procedure itself, while generally safe, carries a small but increased risk of complications like bleeding or perforation as we get older. If you're over 70 and have had normal colonoscopy results in the past, and you don't have any concerning symptoms like bleeding or unexplained weight loss, the odds of finding a life-threatening cancer go down, while the risk of complications from the procedure goes up. Many doctors now recommend discussing whether continued screening truly offers a benefit based on your overall health, rather than just your age. Next up, number 3, routine mammograms. For decades, mammograms have been a cornerstone of women's health, and they have saved countless lives by detecting breast cancer early. But again, after 70, the picture becomes more complex. Later life mammograms are more likely to find very slow-growing cancers that may never cause harm. This is what's known as overdiagnosis. It can lead to a whirlwind of more imaging, biopsies, and treatments that impact your comfort, your energy levels, and your emotional well-being. For women who have other significant health conditions, the side effects of cancer treatment might actually outweigh the potential benefit of finding one of these slow-growing tumors. More and more experts recommend that the decision to continue mammograms after 70 should be a shared one between you and your doctor. It should be guided by your overall health status, your personal values, and your life expectancy, not just by old habits. The fourth area we need to talk about is very strict blood sugar control for diabetes. Many older adults are pushed to keep their blood sugar numbers within a very narrow, tight range. This often involves frequent finger prick testing and aggressive medication adjustments. However, as we age, our bodies become more sensitive to episodes of low blood sugar or hypoglycemia. These episodes can be dangerous, causing dizziness, confusion, and even falls, which can lead to serious injuries. For many Seniors. Having slightly higher but stable blood sugar levels is actually safer than chasing those perfect numbers. Doctors are now often recommending more relaxed blood sugar targets for their older patients. The focus is shifting from achieving a specific number to preventing symptoms and maintaining good daily function. It's about feeling good, not just hitting a target. Finally, the fifth test to think carefully about is routine full-body imaging. This includes CT scans or other advanced scans ordered without any specific symptoms. You might hear them called health scans or preventative scans. While these can be life-saving tools when used to investigate a specific problem, using them for general screening in older adults is often a bad idea. Why? Because they almost always find something. These scans are so detailed that they pick up tiny, harmless abnormalities in our bodies. These are called incidental findings. Once discovered, these findings can trigger a whole new cycle of anxiety. More scans, biopsies, and procedures, all to investigate something that was never going to be a problem in the first place. For older adults, this follow-up process can take a real physical and emotional toll, all without improving health outcomes. So, what connects all 5 of these tests? It's not that they are bad tests, it's that they are often overused and not personalized to the individual. After 70, good healthcare is less about finding every single possible abnormality and more about protecting what matters most: your independence, your mobility, your mental clarity, and your daily comfort. When you ask many seniors what their biggest health goals are, they don't say lower my cholesterol by 10 points. They say things like, I want to stay active, I want to avoid unnecessary hospital visits, and I want to enjoy my life with my family with less worry. There's a huge emotional side to constant testing that often gets overlooked. Waiting for results, worrying about numbers, and being told that something might be wrong can create chronic stress. And that stress affects your sleep, your blood pressure, and your overall well-being. Sometimes, the most powerful thing you can do for your peace of mind is to reduce unnecessary testing. So what's the better approach? It all starts with a conversation. Instead of automatically agreeing to every test your doctor suggests, it's okay to ask a few simple questions. Questions like, what is this test designed to find? If we find something, how likely is it to change my treatment plan? What are the possible downsides or risks of having this test? And most importantly, will the result of this test help me feel better or function better in my daily life? Asking these questions doesn't mean you're challenging your doctor's authority. It means you're being an active partner in your own healthcare. It helps your doctor provide better, more personalized care for you. Many experts agree that after 70, the most powerful health strategies are often the simplest ones. Staying physically active in safe ways, eating nourishing foods, maintaining your social connections, getting good sleep, and just paying attention to how you feel day to day. Things often matter more than frequent screenings. Listening to your body when it tells you something has changed, like your energy levels or your mobility, can be just as valuable as any test result. So, let's quickly recap. After age 70, routine PSA screening for prostate cancer may lead to unnecessary treatments. Routine colonoscopies may carry an increased risk for a lower reward. Routine mammograms may detect cancers that were never going to cause harm. Aggressive blood sugar control can increase the risk of dangerous low-sugar episodes. And routine full-body imaging can create a lot of anxiety for no clear benefit. None of this is about ignoring your health. It's about choosing smarter, more personalized care that fits your life right now. Aging well isn't about doing everything possible. It's about doing what truly helps. If you or someone you love is over 70, I hope you use this information as a starting point for a conversation. Talk with your doctor, weigh the pros and cons together, and focus on a healthcare plan that supports your comfort, your independence, and your peace of mind. Your health is deeply personal, and the best decisions are always the ones that are well. Thanks for watching today. If you found this video helpful, please give it a thumbs up and consider subscribing for more content on healthy aging. Stay well, and we'll see you in the next video.